Right now, the city of Indianapolis is looking for ways to address mental health emergencies while keeping Hoosiers safe. It is part of a call to action from faith leaders who earlier this month asked the city and IMPD to commit to changes. WRTV's Kayla Molander is looking into IMPD's current tool to address mental health emergencies and what new options could soon be available.
I think he gave us hope. I think he helped us to persevere through some very difficult times.
Jean Gaughan's son was in crisis when she first met IMPD detective David Cook-DeDrain.
It could become very violent and difficult to care for.
Cook-DeDrain responded as a part of his job with MCAT, IMPD's mobile crisis assistance team.
I kind of tried empowering their son with resources to get him in control of himself. His immediate reaction at that time was that the police is going to come there and take him to jail. And I said, that's not what we want to do. We want to keep you and your family together.
And MCAT is successful at preventing arrests. An IMPD spokesperson claims that 97% of MCAT calls end with no handcuffs. Instead, officers with the assistance of clinicians from Eskenazi provide support, access to resources, or even something as simple as a bag of food.
Here's just like a little...
But MCAT has limitations.
MCAT 15 is clear.
There are 9 teams that operate from 7:30 a.m. to 6 p.m. Monday through Friday. A group of local religious leaders, Faith in Indiana, wants more. At their Fund Our Future Summit 2 weeks ago, they asked the mayor to form a clinician-focused emergency mental health response team, one that could operate 24 hours a day and be independent from police.
We believe that whenever you call 911, no matter what the situation is, a gun shows up on the scene. And for individuals that are experiencing mental health crises or substance misuse crises, we don't believe that a gun showing up on the scene helps to solve the problem.
Mayor Hogsett is working to create a pilot program that could launch as early as next year. Faith in Indiana says the program wouldn't replace MCAT. It would just provide more of the services that Hoosiers desperately need.
We have an awesome opportunity right now to be able to fund a future for our community that will ensure that individuals that are in crisis get the service and support that they need.
And in the meantime, Detective Cook-DeDrain is on the streets.
I totally recommend that people who have children or adults that are struggling with mental health issues to always ask for MCAT.
Working for you, Kayla Molander, WRTV.
And if you need help dealing with a mental health crisis, you can call 911 and ask for MCAT or another officer with crisis training. If you need mental health services, you can text IN to 741-741 for Indiana's crisis text line. And you can also call the Substance Abuse and Mental Health Services Administration 24/7 hotline. That number is 800-662-HELP. That is 4357.